Okay, well, good evening, everyone. If I do hear sounds coming from you, I may mute you. So when it's time for you, if you want to ask a question, you might have to unmute yourself later. So I'd like to start with instructions for how to access the Spanish station. Veronica, are you available?
Yes, I'm here. Do you want me to read it?
Yes, please.
Okay. Para las personas que necesitan interpretación en español, aprieten el botón en la parte inferior de la pantalla donde dice español. That's it.
Thank you. Okay, so we have Spanish interpreting going on, and I'd like to give a very big thank you to Dinora, who is translating Spanish for us this evening. This was a last-minute emergency call that we put out through the entire state, and Dinora responded and offered to volunteer her evening. So we thank her very much. And so please use that as a reminder that any of the speakers need to speak a little bit slower than usual so that we can make sure interpretation is happening. Okay. So good evening and welcome to our workshop on accessing oral health care for individuals with intellectual and developmental disabilities. We know that some of you are attending from all around the state. Some of the information we share will be general and applied to any regional center. Some of the information may be specific to those on Medi-Cal managed care plans in Sacramento or Los Angeles counties, and some information will be specific to those receiving services from Alta, California Regional Center in the greater Sacramento region. We welcome you all to this important topic. My name is Sonia Bingaman, and I'm the manager of the State Council on Developmental Disabilities, Sacramento Regional Office. The State Council is established by state and federal law as an independent state agency to ensure that people with developmental disabilities and their families receive the services and supports they need. We know that accessing dental care for preventive and emergency care can be very challenging, and the options can be very confusing, and in some cases, very limited. We've organized tonight's workshop to be the start of discussing this topic and educating the community about some of the options. For several years, more than 40 professionals in the dental field, advocates, and family members have met as part of the Medi-Cal Dental Advisory Committee, otherwise known as MCDAC, to look at the services offered, the barriers and challenges, and propose and work on solutions. There are currently several committees tackling these issues. There has been some small improvement to Medi-Cal reimbursement rates, but unfortunately, less and less availability of access to space in hospitals for dentists to offer anesthesia or hospital dentistry. One of the purposes of tonight's presentation is to offer information about alternatives to anesthesia dentistry and to encourage the use of some of those options and supports. In addition to presentations like tonight's, there have been and will continue to be efforts to train more dentists and dental offices about strategies to serve individuals with disabilities to increase the success of dental care in the dental office. Collectively, we know what many of the barriers and challenges are, and we hope this will be the first of many community workshops addressing this issue. We will be recording this workshop and sharing the link out within a couple days. We will also make the handouts available. Please feel free to put any questions in the chat box or raise your hand and we'll call on you when the speaker is open to receiving questions, possibly at the end of their presentation. And at the end, we'll also have an open question and answer session. I'd like to thank our partners, Alta California Regional Center, Liberty Dental Plan, Sacramento County Public Health Department, Sacramento District Dental Society, HealthNet, WarmLine Family Resource Center, and other members of the MCDAC committee, self-advocates, and family advocates for helping to put on this workshop. If you have any follow-up questions, please feel free to contact me. I'll put my email in the chat box or to reach out to your service coordinator. Now I'm going to launch a poll to get your input on the greatest barriers to dental care for your family. We'll launch a final poll at the end of the workshop. And again, thank you for joining us. So a poll should show up in just a moment. and I will read the options. So the question is, what are the challenges accessing dental care? You can click as many as apply to you. So the first challenge is confused about what dental plan I have, or confused about what benefits are covered, or can't find a dentist who takes my insurance, or I don't have dental insurance. Behavioral challenges of a loved one in the dental office, complex medical issues of a loved one, long waits for appointments, linguistic or cultural challenges, and dental staff lack specialized training for working with people with developmental disabilities. And finally, don't know what to do in case of a dental emergency. Feel free to click on all that apply to you. Gonna wait about 10 more seconds. People are still responding.
Is she translating the questions?
She is, yeah.
Okay.
So let's give it another minute because she's translating.
Right.
My apologies, the options are in English. Okay. Nora, do you think we're okay to go? Okay. All right, we're going to end the poll. I will share the results. So the number one reason was can't find a dentist who takes my insurance. And looks like number two was probably confused about what benefits are covered. And a close third would be dental offices lack specialized dental training. All right. Okay, did that disappear for everyone? All right, now I would like to introduce Mary Rettenhouse with Alta Regional Center. She can introduce herself and talk about home-based behavioral strategies. Welcome, Mary.
Thank you. Thank you for having me this evening, and thank you all for tuning in tonight. My personal goal is that I empower you today and give you some more tools in your tool belt than you had when you came, as far as supporting individuals that may struggle with dental care and appointments, or if you yourself struggle with dental care and appointments. So I'm going to start sharing my screen. I have a presentation to share with you all today. Okay, and before we get started on this, I would like to let you all know that I will be presenting some materials and some recommended products, but I do not have any financial relationship, so I don't get paid for advertising these things. These are just going to be some items that I've come across when addressing this content or when talking about dental visits. So we all go to the dentist, right? Or we should. And, you know, we all want that experience to be a positive experience. We all hope we're going to walk in there. It's going to be a routine dental visit and we're going to walk out of there happy as a clam. But sometimes if you're like me and you find out that you need to have a more invasive procedure, and once that needle comes out, you may not be so happy. And so we wanted to talk about the general population first before we get into the complexities of having a developmental disability. And 60% of folks, general population, do have some kind of anxiety about going to the dentist. And the reason or the reasons that that is are listed here. The primary one being they're afraid of the pain, right? I mean, as long as that needle is out, I'm going to be worried that there's going to be pain involved. And I'm sure most of you, if you've ever had a filling, if you've ever had a root canal, even the most strategic and skilled dentist is probably going to inflict a little bit of pain on you. So we all don't want to be in pain. And then 5 to 10% have a true dental phobia, where it's a more debilitating social issue where you will avoid the dentist at all cost. And then we layer in some of those considerations for individuals that have developmental disabilities on top of that. So, for example, difficulty interpreting the environment from the existing cues. I might be able to understand, and you might be able to understand, that the person in the white coat is a doctor or a dentist, but maybe someone with autism who struggles with predicting environment from the cues that are existing is not going to identify that, or they're not going to know what that person is going to do. So when that person puts their fingers in their mouth, that could be pretty surprising. And then also some other common things that can come with having a developmental disability are that schedule, routine, and rigidity and insistence on sameness, right? So a dental appointment isn't going to happen every day. So that's going to be different in the routine, and it's going to shake things up a little bit. Or communication differences. I might be more afraid to go to the dentist if I'm not confident that I can express and advocate for myself, right? If I'm in pain, and to stop procedures that I'm not okay with. We also have common sensory sensitivities. So, for example, individuals with autism may struggle with sensitivity to noise or sounds, which there's lots of noise, lights, sounds, and other sensory things going on in a dental environment. The ability to self-regulate when anxious or stressed, right? Having those abilities to calm ourselves. And then challenging behaviors that can accompany having a developmental disability, things like self-injury, aggressive behaviors, or hyperactivity. So what does this mean then for the population of individuals with developmental and intellectual disabilities as it refers to dental or oral health? Well, we know from this article published in 2012 that almost 90% of folks with intellectual disabilities have experienced tooth decay or cavities, right? Relatively everyone of this population of about 5,000 that were studied. 32 had some kind of untreated dental decay. Almost 11% were lacking teeth. And about 25% did require some type of behavior management intervention, including general anesthesia, in order to access any dental care. The most common barriers that impact dental care and treatment, and I know you all just took a moment to take that poll, and I think that some of those things show up here. According to this other article by Lai, Milano, Roberts, and Hooper in 2012, the primary barriers impacting oral health are limitations in performing daily oral care routines. So I, may struggle with being able to care for my teeth, brush adequately, things like that, floss. And then barriers impacting dental care, the most common was challenging behaviors. So what do we do about this issue? How do we address those skills deficits, right? If we're going back to this slide, those limitations in performing oral care, as well as addressing challenging behaviors if those are the most common, so that we can get to a more positive dental experience. Well, we want to use what we call evidence-based practices or an evidence-based approach. And all that really means are that we want to use things that work. So the world of Google is huge. We all look to Google to get our answers met, or the internet to get our answers on issues that we're struggling with, but there's a lot to sort through there. And not necessarily all the advice that you're going to find online or from talking to a friend are going to work for you. So, what are the things that work for both skills teaching, because we want to increase those adaptive skills so that we have better daily oral care? And what are the things that work for addressing those problem or challenging behaviors? We do have some very nice national vetted resources on evidence-based practices. And the one that our regional center ascribes to most is called the National Clearinghouse on Autism Evidence and Practices. This report was published 2020, so very recent, and it encompasses intervention research between 1990 and 2017. So we have a very long span of research. This publication details 28 evidence-based practices for both skills teaching and or behavior reduction. And it also provides us a lot of free online video training modules on most of these practices. So if you are a parent or a caregiver of someone that has an intellectual or developmental disability, this is a wonderful resource for you to learn more about the evidence-based practices. This is a very big list. It's a little overwhelming, but these are those 28 evidence-based practices. And we're not going to go through all of them today. A, we don't have time, and B, not all of them are exactly relevant for addressing dental issues. But the ones highlighted in yellow are going to be the ones that we're going to talk about today. And you might be familiar with some of these things. So using these strategies for dental appointments, we're going to talk about antecedent-based interventions, modeling and video modeling, reinforcement, social narratives, visual supports. So what do we mean by antecedent-based interventions, right? It's a really complex term. All this means is the things you're going to do before you go to the dentist. That's all that means. And so here are some basic tips of things that you can do before you ever even enter a dental exam. Be strategic about your appointment time, both for the office and the individual. Break up that initial appointment into a few parts. Maybe we just do some pre-visits before the actual appointment. Keep the individual's schedule for the day light. Encourage the use of an additional support person, so an extra person if you have that available to you. Bring any sensory blocking or comfort items that individual might enjoy. And then priming. This is just letting the individual know what the behavioral expectations are going to be for that dental treatment process. And some ways that you can do that is just really asking if that dental office might provide some fun activities that can be incorporated into the visit. For example, video games in the lobby, movies in the ceiling. Ask the dentist to use what we call a tell, show, do method for communicating during visits. So telling the individual what they're going to do, showing them, and then doing it. Ask if the dentist offers or allows for any accommodations, such as noise canceling headphones, sunglasses, lower lighting, and take time to share with the dentist about the individual's specific needs. So do some kind of a pre-visit questionnaire. I've included this photo of a comfort menu that's actually from my own personal dentist office, and I loved it so much that I asked them if I could take a picture for this presentation. So when you go to sit down at Sierra Oaks Dentist, they are going to give you this comfort menu. And you can have any of those things on that menu. They will give you water, blankets, chapstick, a neck pillow, anything that you want. All of these kinds of things are going to make for a much more comfortable environment and set an individual up to be successful. Okay, the next evidence-based practice we are going to go over is called modeling, which is also kind of like pretend playing or role playing going to the dentist, right? So I know what's shown here is a child, but this can also be done with adults as well. And it's very simple. All you need to do is gather some materials such as pretend dental tools, masks, things like that. And they have some little cheap kits available on Amazon. And develop your script. So what is that? What are we going to say? Who's going to be the dentist? What are you going to say? And determine a good time and place to do this kind of practice. Keep the session short to start, and determine how to acknowledge or reward that person for participating, making it fun. And make sure to take turns being both the patient as well as the dentist. The next one we're going to talk about is video modeling. So similar to live in-person modeling, when you're preparing for a dental visit, you could show the individual a video depiction of another person going through the steps of a dental appointment. And so in this age, we all have a smartphone. We're all using some kind of smart device, whether it's a phone or a laptop, right? And so with those smart devices, it's even easier to just create your own video model, in fact, if you wanted to. So again, here are the steps to doing that. Plan your location, materials, and your script. If the dentist office will actually allow you to use their office for a quick video, which most will, that's ideal. And pick up that smartphone, tablet, or camera, make your video, show the individual the video, review the key concepts that you think the individual might need extra support with, and then provide an opportunity for the person to practice, and then prompting and rewarding as needed. I'm going to show you an example of a video model. This one is it's called Look at Me Now, and it's actually a personalized self video model where you can upload an individual's picture of their face and it can be put onto this body and make your own video model.
This is a movie about you going to the dentist. At the dentist's office, you will wait in the waiting room before your appointment.
Hi, it's time to clean and count your teeth.
When your name is called, you will walk into another room. A grown-up will stay with you the whole time.
Okay, time to sit in the chair.
You will go into a room with a special chair. Great job sitting down in the special chair. Now the hygienist will help to get you ready for the dentist. There will be a bright light to help see inside your mouth. Now it is time for you to get a special dentist bib. That was easy. The hygienist will use a mirror to look at your teeth and also count them. Open wide. Great job. This will take just a minute.
1, 2, 3, 4, 5.
Now you are ready to have your teeth cleaned. The hygienist will use a special brush that sounds like this. This is fun, and the hygienist is very gentle. You're doing an awesome job. Now you are ready to see the dentist. The hygienist will go and get the dentist. Good job waiting while the grown-ups talk to each other. Now the dentist will use the mirror to look in your mouth. Open wide. Very good. After the dentist looks at your teeth and counts them, you are finished. The bright light can be moved and your bib can come off. Going to the dentist is all done. Look at you now. You went to the dentist.
Okay, so that's an example of a pre-made video model, but you might want to make your own depending on the age of the individual and what kind of content is relevant and important to share with them. The next evidence-based practice we're going to talk about is reinforcement. I'm sure most of you are probably familiar with this concept, the idea of rewarding an expected behavior. And so with reinforcement, what's really critical is that you do determine both the criteria to obtain the reward as well as what the reward should be. And any guesses on who should be the person selecting the reward? Go ahead and enter something into the chat. Who should select a reward? Yes, Gail. Gail says the person going to the dentist. Yes, because I might think, oh, yesterday you liked chocolate ice cream. So today your reward is chocolate ice cream, but maybe you're over the chocolate ice cream, right? You just had it. Yes, based on patient interest. Exactly. Very good. Okay. And you do want to have a variety of options or choices available if possible, just in case that interest changes. And only deliver the reward after the task has been fully completed. And here's a couple of visual examples of how you might depict or support the individual to show them how they're doing. So for example, an individual that might need some reminders of how well they're doing with each different step, you might use a full schedule like this to show them and then check off, okay, we waited in the waiting room, next we're going to sit in the chair. Great, sitting in the chair, check that off. And then folks that maybe are a little bit more experienced with going to the dentist, but maybe just don't prefer it, maybe you would use something like a basic first then strip as a visual reminder that yes, first we are going to the dentist, but then we get to do something fun like play in the pool. Okay, and then the next evidence-based practice we're going to look at are social narratives. These are also called social stories. There are several types of social narratives under the heading of this evidence-based practice, but social stories are the most well-known. You may have heard the name Carol Gray. She's the person who developed social stories as a concept. And what social stories do is they visually depict a social situation that provides relevant cues and describes expectations of appropriate behavior. And so you'll see down here this website, www.pathfindersforautism.org, and you all will get a link to a folder with this presentation, so don't feel like you have to write this down, but there are links to 12 different free pre-made social stories about going to the dentist on this website right here. So you don't even have to make your own. But what you want to do is you want to make sure you use it in a way that's going to work. So using a social narrative, the important thing to do is introduce it, make sure the individual reads the social narrative or has it read to them if they're not a reader, and then have the individual participate in the identified social situation or a mock situation. This is the part I think we miss a lot, is that we might read the story, but we don't actually role play it out, right? And then review the key concepts and provide support and reinforcement as needed. Okay, and then the last evidence-based practice for going to the dentist that we'll talk about are visual supports. So visual supports can come in a lot of different types and styles. So a visual timer, for example. So if an individual is not able to tell time, maybe something like a time timer where that red successively gets smaller to show the individual that the time is up. Or something like a sand timer could be helpful. Or even these kind of stoplight looking timers where, they start at red and then as the time is winding down, yellow, then to green when the time is up. Other visual supports might be a visual cue card, for example, to help with communication or checking in. How are you doing? Do you need a break? Are we doing good? Are you okay? And then also another type of visual support could be something like a picture schedule to show the individual what all the steps are that they're going to be completing while at the dentist's office. So those are examples of how we might use evidence-based practices in the dental environment. But as we discussed initially in this presentation, it's not all about just being at the dentist. It's about the daily oral care and our ability to do that well. So really, where do we do our own oral care? We do it at home. So, you only go to the dentist, once every 6 months or so. So I think that's what's recommended, although I'm not a dental expert. So we also want to make sure we talk about how to use these strategies to support just regular routine daily oral hygiene practices at home. So visual supports, like we just showed, can also be used in the home environment, and that could be either a mini schedule of how to brush teeth, or for readers, maybe just a written list of reminders of the steps, or something like a chart so that I can help keep track of when I have brushed, and maybe I cross off or circle the sun when I've brushed in the morning, and then the moon when I've brushed in the evening, to help me remind me that I am taking care of my teeth consistently. Reinforcement in the home environment. There's two different ways that you can use reinforcement. You can either make the activity itself more enjoyable, so making brushing or flossing more enjoyable. Some ways to do that could be using characters or fun toothbrushes that the individual might enjoy, using flavors. I think Colgate has like 30 different flavors of toothpaste. So finding a flavor that the person enjoys. And then there's also extrinsic or external rewards. So things that we can give outside of the activity to make taking care of our teeth a little bit more exciting and fun. So that might be depicted with something like a reward chart. And once the individual brushes all of these times, maybe they fill in what their extra special reward is going to be. So maybe an extra privilege, or maybe they get to go to the movies or something like that. And so we talked about modeling and video modeling of the actual dental environment, but modeling and video modeling of tooth care can actually be very effective and helpful as well. And so here is an example of a video model of taking care of our teeth.
To brush your teeth properly, use a light bristled toothbrush and fluoride toothpaste. Start brushing by placing your toothbrush on your front teeth at a 45-degree angle. Then brush each tooth in a circular motion for 3 to 5 seconds. Once you've finished brushing your front teeth, move on to your molars. Then brush the back of your teeth. Finally, softly brush your tongue to get rid of bad breath and plaque. It should take you about 2 to 3 minutes to brush your whole mouth. Brushing for 2 minutes twice a day helps to remove plaque and keep your teeth healthy for years to come.
So short video, but helpful. This one I would say could be, more applicable maybe to teens and adults. And then we also have a link for one for kids as well. And so using technology can really be your friend with oral care, making it a little bit more exciting, making it a little bit more fun. So here's just some examples of different apps and books that cover this content and can really help teach the concept of what it means to brush teeth. And technology-aided instruction is another evidence-based practice. So feel free to use all of those fun apps. I think, Daniel Tiger has a song or a story for everything. And then on the note of technology, there's also these smart toothbrushes, which are really cool. So they have some that are more for kids and some that are more for adults. But what these do is these toothbrushes link up to an application on a smart device, and they actually show you the quality of your brushing. So you can look into these a little bit more, but it's a really nice teaching tool to coach the person through brushing their teeth and making sure they're doing a good job. Some additional considerations just to keep in mind as you go along, or as some of you, maybe you've been a caregiver for a long time for an individual and have struggled with this issue. And so certainly you can attest to behavior change may not be quick, and there could be a lot to troubleshoot, whether it's the quality of your rewards, the type of your rewards, how often they're given, what the criteria is. And so really small steps might be necessary to shape the behavior over time and get that desired outcome. And always consider consulting and seeking the support of a qualified professional. Someone like a board certified behavior analyst could be very helpful to you if you come across some struggles. And in fact, there are 4 behaviorists at the regional center. If you are a regional center client, or you caregive for a regional center client, you can access their support on a limited basis. Always collaborate and communicate with any professionals involved in the process, just to make sure that you're having that kind of clear, open communication to communicate any potential issues or to avoid any potential issues. Always strive for consistency. So don't just start talking about brushing our teeth the week before, we're going to the dentist, but just keep that as something that's a daily part of the routine. Educating yourself on the options. So taking that time, and it can be very time intensive, to research all of your dental provider options, and asking those questions like, do you accept adults even though you're a pediatric office? And determine if the individual has these prerequisite skills needed to participate in a dental visit. So things like, can the individual remain seated for 10, 15 minutes? Can the individual respond to single step instructions? Does the individual allow other people to touch their mouth? If not, then maybe those are the things we need to start working on first. And this article is very outdated, but I found this this piece of information kind of interesting. And it indicated that if an individual has a developmental age of at least 29 months, so to about 2.5 years old, developmental age, then the person with coaching and training should be able to tolerate a basic dental procedure. So if we can kind of set that as a bar to say, okay, well, if we've got at least that, then we should really be trying these things before we resign ourselves to needing only, sedation dentistry for the rest of that person's life. It's worth a shot. Okay, and so as far as putting all of this into action, we wanted you guys to, not feel too overwhelmed with, okay, you shared a lot of resources, but how do I use those? Where do I get them? So we are going to give you all access to a Google Drive that is going to have all of these kinds of tools in it. So one will be what we call a strategy selection tool. So it's going to help guide you in which of these practices might be helpful for the individual based on their needs. And then also a patient support needs questionnaire. This could be something you fill out and give to a dental provider to help communicate the individual's needs. Visual supports, so you'll get a pre-made first then, picture activity schedule, brushing teeth mini schedules, sample social stories, sample video models, and the Autism Speaks Dental Toolkit, which is a really nice tool. And now I will stop sharing and see if anyone has any questions.
Yeah, there was one in the chat from Catherine Crowley. Her question was, what suggestions do you have regarding individuals who habituate to charts? The charts may work for a few months, but eventually the individual utilizing them begins to ignore them.
That is a very good point. So anything that we have in our environment, we just get used to after a while, right? And we start ignoring it. It's in research, they call it an observer effect, so once you have, that's why in research, they'll have you put a camera in a room 3 days before you actually start taping, just so that can happen, right? So, so keeping in mind those steps. So you want to look at the steps to implementation of how you actually go about using it. And so what that means is I'm going to consistently review it and prompt the individual. And if they are, not looking at it, not referencing it, but they have the capacity to do it, you may want to think about moving to more of a self-management or self-monitoring tool, or even using some of those technology-aided instructions or the toothbrushing, the smart toothbrushes that have the built-in coaching. So yeah, may just take some prompts and reminders, but we want to make sure we're always implementing it, and as well as the social stories, we're implementing it consistently.
Any other questions right now for Mary? Okay, great. Thank you so much, Mary. I'm sure there may be questions at the end, so hang tight. Okay, now I would like to introduce Danielle Canarosi. She's the Community Outreach Manager for Liberty Dental Plan. And I'm going to turn it over to her now. After Danielle speaks, we will have Kelsey with Alta Regional Center. Then we'll have some personal stories from a self-advocate and from a family member, and then we'll be open to questions again. So thank you so much. All right, Danielle, your turn.
Hi, everyone. I am just going to pull up my screen here. And for some reason, even after how long, it still takes a moment. So as Sonia said, my name is Danielle Canarazi, and I am the Community Outreach Manager for Liberty Dental Plan. And tonight I am representing Liberty, HealthNet, and Access Dental in Sacramento County. We are the 3 dental plans for geographic managed care. And so I am going to share my screen and make sure that this comes through. Hang on just a second here. Okay, so what I want to go over with you this evening is how to make a dental appointment. And it's going to be a bit different in Sacramento County and Los Angeles County. In Sacramento, we have mandatory enrollment into the dental managed care program. So in that program, you or your loved one is automatically assigned to a dental plan. So those dental plans are, as I said, Liberty, HealthNet, or Access Dental. In Los Angeles, it's similar that the dental plans are there, but the individuals have to switch from the Medi-Cal dental program into the dental managed care program. So I am just wanting to make sure that that is clear. I will also be going over with the other counties how that works for making an appointment as well. So in Sacramento County, on the left-hand side here, we have, if you are a parent, guardian, or caregiver, and you are familiar with who your dental plan is, with that dental plan, you are automatically assigned to a dental home. You also have a lot of rights with that you are able to change that dental home to any of the dentists in our network. And we have quite a few. We have many for you to choose from, so you can find just the right fit for your loved one or for yourself. And once you know who your dental plan is and your dental home is your dental office, but we like to think of it as a dental home because that's where you go. That's where you have that relationship with the dentist and the dental team to care for your oral health needs. So you will make an appointment with the assigned dental office. And for anything that office needs, they would then contact the dental plan. So they would contact Liberty, HealthNet, or Access for any help following up on referrals or any authorizations that you would need. So the dental plan has a lot of different departments, from our member services department that are available for you to call at any point in time if you're having any issues making a dental appointment. I think I actually made myself some fun little arrows here. Let me see if this actually is going to work. There we go. So you'll hear me say this a lot. Call your dental plan for any issues. Our member services department can transfer you to the claims department if you're having issues with anything. If you need help getting a referral, or you have a referral to an office and you want to switch to a different office for that referral, we can help you do that. We can also help make those dental appointments for you. So again, there is a number on here at the very bottom that if you're still having trouble, if you are not able to get the assistance that you need through your dental plan, you're welcome to call the State Department of Healthcare Services, the beneficiary dental exception line. But we truly, all of the dental plans really strive to make sure that your needs are met and that we are doing everything that we need, or everything that you need from us. That is the entire point of having dental plans is to make sure that we take care of our members. On the right-hand side here, I also, let's see if this one worked. Oh, there we go. Okay. Me and technology, we don't always get along. So I'm really excited that these are working. So if you don't know what dental plan you have, you have a few options. The first option is to call healthcare options to find out which dental plan you or your loved one has. And you can also call healthcare options to change the dental plan. Like I said, you have a lot of rights, and we want to make sure that you find the right fit for you. So, and I say that to Liberty members as well. I know I work for Liberty, but I'm representing all of the dental plans this evening. We want to make sure that, again, we serve you as best as possible. So the phone number for healthcare options is right on the screen here. And I'm also going to give you another option for calling in Sacramento and the surrounding counties, which I'll go over what those counties are. For Sacramento, you can also call the Sacramento District Dental Society. They have the ability through our medical dental referral and navigation system that they can look up which dental plan you have, and they can submit a referral to your dental plan to contact you and to help you. So if you don't have, the chance or the time to call healthcare options, you can call the Sacramento District Dental Society, and I also have that number in here as well. So you call the healthcare options or Sacramento District Dental Society, and they tell you what dental plan you have. What's next? From there, you can call your dental plan to do a lot of different things. You can find out which dental home you have. If they tell you what dental home you have, you can then change that dental home. You can get assistance with referrals to specialists. We have a extensive network of specialists in Sacramento County, as well as in Los Angeles, that we can refer you to and help you set up a dental appointment with. And we can also help you schedule free transportation or a free interpreter and translator to go to the appointment with you. So those are really important. Yes, we will definitely share this flyer again for you. I know the print is quite small, but this information is available for you and will be shared as well. So you call your dental plan, we help you make a dental appointment, we set up free transportation or a free interpreter for you. And from there, again, the same steps that if you want to call and make an appointment yourself, you can do that. And if you are not able to get a hold of them, get a hold of the dental office, you can call your dental plan. Again, call your dental plan for any assistance. And that is our job. I do want to say one last thing here. As far as Liberty members go, this is semi-new to us, but we have a team of dental wellness advocates that you can, if you are a Liberty member, you can actually text everything that you would do to call us. You can actually text with us to do that. And you can also do that if you are Spanish speaking as well. And so that is, you can text the word talk to 22925 if you need any assistance, and our dental wellness advocates can help you take care of that. So if you are outside of Sacramento, outside of Sacramento, and we did talk about the Sacramento District Dental Society, they also can assist anyone who lives in Yolo, Amador, El Dorado, and Placer counties with getting to the dentist or helping find a dentist for them. And so we're actually going to go on now to those other counties outside of Sacramento. And so this is, I'm going to go here. For anyone outside of Sacramento and Los Angeles, if you do not have a dental managed care plan in Los Angeles County, the Medi-Cal dental program, which is also referred to as fee-for-service. So you might hear that as well, the fee-for-service dental program. The other 56.5 counties in California have the Medi-Cal dental program. Smile California is the website that they have launched in the last couple of years that makes finding information a lot easier than it was before. So this is information that I got right off of their website for any help if you need assistance finding a dentist. You can go to smilecalifornia.org or calling the telephone service center, which the 800 number is right there, 1-800-322-6384. The Medi-Cal dental program does work differently than the dental managed care program, as they are not currently equipped and not equipped to set up appointments for you. So you would call the dentist yourself and schedule the appointment for your loved one on your own. And sometimes a lot of people like to do that. They like to have that control. So that is what you would do in the dental fee-for-service program. So, and they have some fantastic information on their website as far as what services are covered. I did see in the chat that I saw that Rick made the point that it is true for anyone that is 21 and over. Currently, it is one dental cleaning appointment, one exam a year. However, I would suggest staggering those appointments so that you do go every 6 months. One time you would get a cleaning, the next time you would get an exam. That is how I have seen people work through that. We are also currently and always advocating for 2 visits. And so that's something that we are always working with our local legislature on, and making sure that those benefits are updated. And so if anyone is interested in helping advocate for that, the Sacramento District Dental Society can definitely help your voice be heard, as they are also always advocating for that. I'm going to stop my share for a brief moment here. That's information that will be shared tomorrow as well. The Sacramento District Dental Society can also help, and different dental societies throughout the state can help if you are outside of Sacramento County and you're needing assistance with finding a dentist. Calling the Sacramento District Dental Society, they can put you in contact. If they don't serve your county, they can put you in contact with your local dental society that can help you with advocating in your local area for referrals. And I know that the Alta Regional Centers do a spectacular job with advocating as well. I'm not entirely sure how many people outside of Sacramento County we have right now. So there is a lot of information available through the dental societies as far as helping with finding an appointment or finding a dental provider. And I'm going to pause and see if there are any questions, just so I can answer specifics. I'll also put my email address in the chat, because whether you're a Liberty member or not, I would love to connect. And there's a lot of specifics and a lot of individual issues that people have that I would love to help see if I or anyone else can help figure out where exactly you or your loved one needs to go. I said I was going to pause, and then I kept talking.
Thank you so much, Danielle. Are there any questions right now for Danielle? Feel free to unmute or to raise your hand or to put a question in the chat box. So that was a lot of information, a lot of phone numbers. We will be sharing out the flyers that she shared with you tomorrow. So you'll have that information.
So, and I did put my email in the chat, so please feel free to email me. I will also put my phone number because I would love to talk to you.
And as you'll hear in a little bit, Danielle is an incredible resource. So there's a lot of N's and O's in her name, but write that email address down very carefully because she's an incredible resource if you're trying to access dental care. And if she doesn't know the answer, she'll find someone who does. There's her phone number in the chat. Thank you so much, Danielle. We are now going to turn it over to Kelsey Rainey. She is with Alta Regional Center, working in the Community Services Department. And she's going to talk about Alta Regional Center's role in supporting your access to oral health care. Thank you, Kelsey.
Thanks, Sonia. I appreciate that introduction. My name is Kelsey Rainey. I'm a community services specialist at Alta California Regional Center. And that means essentially I'm one of the behind the scenes folks that helps develop and monitor our services and vendors that work with the regional center in order to provide services to our clients. So what I'm going to be talking about today is the role of the regional center in accessing your oral health care. Sorry about that. There we go. Briefly, I'd like to chat about what is the regional center. A lot of you here probably are already familiar with what the regional center is, but for those of you who aren't, we are unique to California. We were established under the Lanterman Act in 1977. We're a group of private nonprofit organizations, and there's 21 regional centers throughout the state of California. We contract with the California State Department of Developmental Services, and we are an entitlement program, which means that all of our services are voluntary and there's no cost for most of our services. I do have a caveat down there that there is a family cost participation program that applies to some clients for some services. The client is under the age of 18 and they're not covered by a Medi-Cal benefit. Alta California Regional Center serves approximately 27,000 people with developmental disabilities over the age of 3 years old. And we have 8 offices serving 10 counties. So that covers Sacramento, Roseville, Placerville, Grass Valley, Woodland, Yuba City, South Lake Tahoe, and Truckee. No, I don't have all those memorized, though that would be pretty cool. I'm sure there are a lot of staff at the regional center who do. And if you're eligible at one regional center and you do decide to move to another area in the state of California, your eligibility can transfer. We will do what we call an inter-regional center transfer, and your case can be picked up by the regional center where you move within the state of California. And then do a little brief history of dental services and regional centers. We originally got involved with assisting in providing dental services for our clients when there was a budget deficit. In 2009, there was a budget deficit that rescinded all Denti-Cal benefits for the general population, including regional center clients. In 2012, regional centers were able to fund dental services through an agreement between the Department of Developmental Services and the Department of Healthcare Services. In 2014, basic benefits were restored to the general population, and in 2018, there was a full restoration of dental benefits. That's kind of boring, but it gives you a little bit of history as to why the regional center is involved with dental services. And that leads us to our next slide, is when does the regional center become involved with dental services? It's when the needs of the client are reviewed by the planning team, which includes the client and any caregivers, family members, advocates, etc. And the needs for services are clearly documented in the individual program plan. There are no other public or private funding sources available, and or all alternative funding sources have been exhausted. The requested dental treatment, follow-up, or products that are being requested are medically necessary and related to the client's regional center qualifying diagnosis. So that means that when a client is made eligible for regional center services, they fall under one of 5 qualifying diagnoses. And this just means that the dental treatment needs to relate to one of those diagnoses. The dental provider must also be vendored with Alta California Regional Center. That means that we have a mechanism to fund for services without being vendored with the regional center, which is a bit of a lengthy process. We are not able to fund. And then Alta California Regional Center will reimburse for dental services according to Medi-Cal schedule of maximum amount allowances. This is written into our regulatory guidelines, those sort of rules of how the regional center can operate. And this just means that we can only fund up to what Medi-Cal would be able to fund. And I'm going to pause here because I just threw a lot of information out and I'd like to see if there was any questions. I did see a hand go up.
Kelsey?
Yeah.
I had promised the interpreter a break midway through, so
Oh,
you did share a lot of information. So
yes.
let's take about 4-minute break, and if anyone has a question, they can post it in the chat. Just take a minute. We'll leave that slide up there for you to look at,
Sorry about that.
and then we'll continue on in a couple minutes. Thank you so much.
Yeah, no problem.
Take a minute, stretch, wiggle your fingers, wiggle your toes.
And I'm not able to see the chat, Sonia, so if anything has come up, please feel free to let me know.
We will. There's one question. I'll tell you what it is now. I think it was directly to me, and then you can answer later because I want to make sure that everybody will be able to hear it.
Absolutely.
The question is, are braces covered at all by Alta?
We will definitely cover that when we get back to it.
Thank you.
Mm-hmm.
Denora, are you all set? Thank you so much. Okay. Kelsey, are you there?
I am here.
Okay, we can continue on. Thank you so much.
Perfect. Thank you all. I'd like to address the question, are braces covered by Alta California Regional Center? Before I answer, I would like to say that we do evaluate client services on an individual basis. So if there is a medical necessity, again, if this area here where the requested dental treatment, so if those braces are medically necessary and related to the client's regional center qualifying diagnosis, then that's something that we can look at. Typically, we tend to not fund for braces because it is something that people without disabilities also require. So anybody, general population or not, could require braces. But that's not to say that we will never ever fund braces. Like I said, we do review every case. I'll talk about it a little bit later, but we do have a dental committee. So if there are situations like that, then they can be addressed and discussed individually. Okay, any other questions before I move on?
I don't see any, and I don't see any hands raised. So go ahead. Thank you.
Great, thank you, Sonia. I'm going to switch gears just a little bit, and we're going to talk about service coordinators. So your service coordinator is your primary contact at the regional center, and there's a lot of really great things that they can do for their regional center client that they're serving. They do have a caseload and serve multiple clients, but they help develop positive rapport with the family and their clients. They write an individual program plan every year. They have some knowledge of generic resources. They attempt to proactively address client needs, monitor health and dental care status, etc. So how can your service coordinator support you with dental care, or your loved one if you're somebody who supports a regional center client? So the service coordinator can ensure that the need for dental care is documented in the individual program plan. If the need for dental care arises outside of your annual cycle, you can always request that an addendum be made. You can call a planning team at any time, a planning team meeting at any time, and amend the IPP that way. Your service coordinator can assist in advocacy with Medi-Cal, Denti-Cal, and the dental office. Your service coordinator can provide an eligibility letter that notes the client's regional center diagnosis. They can help obtain consultation with the Alta California Regional Center Dental Committee for individual dental concerns. So this dental committee consists of service coordinators, myself, a community services specialist. We have management and upper management that attend, as well as a staff physician, to help review dental cases and try to give the most appropriate feedback we can. And your service coordinator can also submit purchase of services for approved dental procedures that will be funded by the regional center. Some things your service coordinator can't do. We all operate within the limitations of, the guidelines and the HIPAA compliance as well, those sorts of things. So your service coordinator cannot discuss a client's case with Medi-Cal, Denti-Cal, or a dental provider without either the client, the parent or guardian, or conservator present either on the phone, in person, or unless there's a signed release of information on file. This is due to HIPAA compliance. And quite frankly, when we call without this sort of information, they won't talk to us. It doesn't matter that we are another agency. It is very important to remain consistent with that HIPAA information and make sure that your information stays confidential. Your service coordinator can't schedule dental appointments. Danielle talked a little bit earlier about how there's great resources on accessing interpreter services, transportation, and assistance with scheduling those appointments. Your service coordinator, as I said, on the other side, they can assist in advocacy. So if you'd like some assistance calling or you need help finding the number, your service coordinator can definitely help you out with that. And lastly, your service coordinator can't keep an updated list of dental providers, especially not one that are accepting patients at this time or that accept your particular insurance. Due to the number of different insurances and providers in our area, it's just impossible for a service coordinator to keep a list. The best way your service coordinator can support you in finding a dental provider that accepts your insurance is by calling the numbers that were provided earlier by Danielle. Next up is how to contact your service coordinator. Maybe you remember getting a letter. There is staff turnover. Sometimes your service coordinator may change unexpectedly. You might not know who your current one is. So if you do know their first and last name, you can use our website staff directory, which can be found at the link listed there. You can also find it under the Contact Us tab on the Alta California Regional Center website. You can type in their name or you can search by a list of names and you can get their phone number and email address as their direct contact information. If you aren't so computer savvy or don't know the name of your service coordinator, you can always call our ACRC main office line during business hours, which are Monday through Friday from 8 a.m. to 5 p.m. The phone number is listed here. This PowerPoint will also be included in the packet of information that Sonia sends out tomorrow. But you can call the main office line, press 0 to speak to the operator. You can either ask for the SC by name or provide information regarding the client so they can look up the service coordinator who will assist your client. As I mentioned previously, sometimes there's staff turnover or sometimes staff may be on vacation. So if there's a situation where your loved one or yourself are on a vacant caseload or your service coordinator is out of the office for an extended period of time, you can also call that main line, press 0 to speak to the operator and ask for the officer of the day. And they'll be able to direct you from there. So you'll be able to talk to somebody. Any questions about service coordinators? Before we move on. Looks like we're doing good. At this time, Alta California Regional Center is vendored with 2 dentists. We have Dr. John Barakat, who provides traditional chair dentistry services. He will bill Denti-Cal prior to requesting funding from Alta California Regional Center. If funding is requested from the Regional Center, then this will be presented at Dental Committee for support to be able to move forward with the funding. And then we also have Dr. Rodney Bagao, who provides oral surgery. He's an oral surgeon that provides hospital dentistry services under sedation. He bills Denti-Cal and Alta California Regional for services. An ACRC purchase of service authorization is required prior to appointment. And this is because there's a part of the service that Denti-Cal doesn't fund that we are able to. And this is supported by the client not being able to access regular chair dentistry through their insurance. Another great resource we have is our registered dental hygienist and alternate practice, our DHAP. They're licensed to provide dental hygiene care to those with limited access to care in the traditional dental office setting. Services can be provided in a home or community setting, and they primarily bill Denti-Cal for services, but they do have the ability to bill Alta for additional time or services that are not covered by Denti-Cal. Some of the services they provide include dental and periodontal health assessments, consultation with a dentist or physician regarding the patient's health, preventative dental cleanings, sealants, fluoride application, oral health education for patients, family, and facility staff, and nutrition counseling. If you have a client or loved one living in a care home, a lot of times our care homes will partner with the RDHAPs to have them come out in between regular dental visits. We also have some resources in development, and this is really exciting to share. We have partnered with the Sacramento Community Clinic, and there's currently one being developed on El Camino Avenue. It will be a health and dental clinic serving all people with Medi-Cal benefits. It is equipped with a versatile dental chair capable of tilting a patient backwards for dental care. And this means that if you have a client that utilizes a wheelchair, either in your home or somebody that you care for, or you yourself are in a wheelchair, they can tilt you backwards. So there's no danger of being harmed during transfer into or out of the dental chair. Some other resources we're working on is currently we have a collaboration we're working on between our vendored ABA vendors and our RDHAP vendors and dental providers. The goal is to provide behavioral intervention strategies, including desensitization and those evidence-based practices that Mary mentioned earlier, to assist in increasing the probability that a client can be seen for dental care without the use of sedation or hospital dentistry services. We're also working on a collaboration with California North State University. This is a multi-agency effort to increase education and training to dental providers in the area of developmental disabilities and a lot more. There's a lot of really great ideas that we're working on in hopes to make the dental process so much easier for clients and families to navigate and access. And so if there's any questions, please feel free to ask now. If you have client-specific concerns, please contact your service coordinator. And thank you so much.
Thank you, Kelsey. Are there any questions? I don't see any in the chat. So the message there is to contact your service coordinator.
Oh, let me stop sharing.
Oh, yeah.
Okay.
Sonia, it's
Yep.
Danielle. Can I make one?
Of course.
Oh. Oh, sorry, I didn't realize my camera wasn't on here. I wanted to just, first of all, applaud the service coordinators at Alta, and let everyone know that the service coordinators with the dental plans in Sacramento County, they have also helped to contact myself. I know specifically, I've helped with a few issues. So they can also, they have the resources to contact us for you as well. And we can help set up things like, for example, for children, if there is a medical diagnosis letter of any developmental disability that says, they need to stay, their dental home needs to be a pediatric specialist. If we have a copy of that letter, and the Alta Regional Center helps me in sending that to me and obtaining that information for you, and sending that to me so that we can put a permanent referral on file for children and even younger adults. We've done, I know, to stay at a pediatric specialty office where they tend to have a slower pace and have more experience with individuals with any type of special need. So that's also an option. And Alta was the first people to really bring that to my attention. So even if you are an Alta client or you are not, you can contact myself for that, for any of the dental plans, or the service coordinator can help you contact us as well.
Absolutely.
Thank you. Yeah.
Thank you so much, Danielle. And I do want to kind of go back to that point where I had talked about where the SC can consult with our dental committee. I'm one of the members that sits on the dental committee, and when we run into issues where we sometimes hear that there's going to be a charge for a dental procedure that we believe would be covered by benefits, or somebody needs assistance accessing care, things like that. We've been able to field those back to Danielle and the other service coordinators that work through that outreach program to be able to help. And that's been really empowering and really cool to have that collaboration now.
So you have Kelsey, you have Danielle's email in case you have a question. And if you talk to your service coordinator and you're still having some challenges, then ask them to get some support, because there may be some resources that Kelsey or Mary know that they can support the service coordinator. So if the service coordinator gives you some information and you go off and try it and it doesn't work, come back and try again. And they can reach out to their committee, or they can put you in touch with Danielle or another plan to help look up what your plan is, what the benefits are. So don't give up. And with that story, I want to have Natalie join us and share a story that she has. So last year, we know that there are challenges with accessing, especially hospital and anesthesia dentistry. We know there are shortages of both space in the hospital and dentists who are able to do those procedures. So one of the things that we can do is share education, like we're doing tonight, about methods that you can do to increase your or your family member, your loved one's ability to tolerate getting dental care in the dental clinic instead of needing anesthesia or dentistry, or learning that maybe some information that you were given is not correct, and having some resources for where to call or who to ask to see if that's correct. And that's something that Mary and Kelsey and Danielle are all great resource people for. So a couple years ago, Danielle and I started going out to some of our programs and doing preventive dental workshops and training people how to brush their teeth properly, how to floss, what good food choices are, what good drink choices are, all to have the best dental care we can have. And during one of those trainings, Natalie met us and had a question for Danielle. So Natalie, I'm going to go ahead and let you share your story.
Where to start? That's my question. Well, it was a while back. I was having teeth issues, which I just missed 2 of my teeth. And one of my dentists, I had a hole in my teeth. They told me that, oh, you need a root canal. And then they went to call my insurance, and my insurance was like, no, we can't do it unless you get pregnant to have a root canal done. That was kind of weird. Like, why would you say that? So that was my experience.
So what happened?
Well, after that, I went to another dentist. He took out my other tooth, but this tooth swelled up so bad, it swelled up my right side of my face. And now it's I don't have any more teeth. I only have 2 teeth up here. I mean, I have everything else, that all my teeth there. It's just I'm missing 2 up on top.
What was your question when you met Danielle? Do you remember? Your
don't
dentist was,
remember.
oh, your dentist
Danielle,
was.
do you remember what I said? Because I don't remember.
So from my understanding, I believe you needed a crown?
Crown, yeah. They were saying I needed a crown, but they said, no, you need to have the baby for you to have a crown.
And weren't
That's
they
what my
also
insurance
telling
said.
you, weren't they telling you that you had to pay for it? Didn't
They told me I had to pay between $800 to $900.
Yeah. I remember meeting you, and I remember you saying that, and that caught me off guard because that's not the case.
Yeah, they said, oh, because she's a female, she needs to have something done, and then the only way for you to have a crown is unless you can give us the money or you can something else.
Because coverage was different before 2018 for pregnant women, and after 2018, which is we met in 2000. Was it 2018 or 2019?
Somewhere around there.
Yeah. And so things had changed, and the adult dental benefits were reinstated. So what Natalie didn't know was that the crowns were a covered benefit. She did not have to pay out of pocket. And so that still goes today. Adult dental benefits are reinstated, and crowns are a covered benefit.
And I did not know that.
Yeah. So we were able to get Natalie to a dentist that did the crown and didn't charge you, right?
Mm-mm.
Perfect. And that's exactly how it should be. Is hopefully what Natalie learned is that you call your dental plan if you have any issues or any questions. If a dentist is ever saying that, especially, for Natalie going in and, doing all this on her own is amazing. And someone is asking, explain why they told her she would have to be pregnant. So that is definitely a weird thing for a dentist to say.
The dentist called the insurance, and the insurance is the one who said, oh, she needs to be pregnant.
Yeah. So So
for it to go through to get her crown, for me to get my crown.
So before 2018, and Gail is asking that, before 2018, the coverage was different, so that adults did not have a lot of dental coverage. They didn't have a lot of benefits that were covered. However, when a woman became pregnant, her coverage changed, and they were able to cover things like crowns. And so that was before 2018, and which was why that they were trying to make that distinction, I guess. If
this one over here would have been 800 and this one over here would have been 900.
Yeah.
So I'm like, I don't really have that much kind of money.
Gail asked, what about a man? That is not an answer I have.
Nope. I don't have the answer either.
Yeah. So luckily I met Natalie after the adult benefits were reinstated. And she was able to get those crowns covered and not pay out of pocket, and not be pregnant. So that is and those are things that the dental plans are, and I can say, you know, I know Sonia and Mary and Robin are always working on advocating for those things to be covered in that way, so that people have more coverage, kind of like the adult dental cleanings being covered. We're advocating in the same way. That's how dental benefits for adults were reinstated, because a lot of us squeaky wheels constantly advocated for adult benefits to come back. So we're working on that cleaning, that second cleaning a year. But yeah, so that was, I'll let Natalie continue with her experience and making sure that she didn't get charged.
Did you get charged, Natalie?
Huh?
Did you get charged?
You have to pay out of pocket?
No, because you had the information, yeah, from
But
Danielle.
the thing is, I went to a specialist for braces, and they said my insurance would not cover it. I have to pay $1,000 out of pocket.
Yeah, unfortunately, braces are actually something else that we're advocating for. And right now, the state of California has a guideline, basically, almost like a grading scale that they go through. And since the dental plans are also vendors of the state, so we have to go based off of the same things that Medi-Cal dental covers, that the state says is covered. So unfortunately, we have to go by those same standards, and the state of your mouth, of a person's mouth, has to meet a certain score in order to have the benefits be covered. So in order to have the braces be covered. And unfortunately, the score has to be really high, basically meaning your teeth have to be incredibly messed up in order to get that covered. However, like we said with the resources here, we're always advocating for that to be changed. But the Sacramento District Dental Society is also currently working. What they do is they work with dentists in the area, and the dentists are, and also orthodontists, because the orthodontist is the one that does, that puts the braces on your teeth and takes care of those braces. They are working with their dentists to either do low cost or no cost braces. So that phone number that you'll be provided tomorrow, that you had earlier as well, you can call them and talk to them about how to get your loved one into care for braces if they cannot pay out of pocket for it. So again, it's another great resource, and we're constantly advocating.
Kelsey, we have a question that it's from the Spanish channel, so I don't think you can see it, but the question was, do all regional centers have a dental committee? And I would add on to that, do all regional centers have a dental coordinator?
I will start with the dental coordinator question first. No, unfortunately, not all regional centers have a dental coordinator. A dental coordinator is somebody that, in my experience from those that I have met, they have more of a dental background and they're able to schedule and do a little bit more planning and things like that for dental appointments. As far as regional centers having a dental committee, that I'm not sure of. Every regional center operates differently. We all interpret the regulation differently. We're all separate entities. I also worked for Valley Mountain Regional Center, and from what I remember, because it was quite a few years ago, they did not have a dental committee. But we are fortunate here in the Sacramento area. We've got a great staff physician team and other people who will collaborate on trying to find solutions for our clients.
Thank you, Kelsey. I am going to try to share, and please, if someone can verbally tell me if you can see this and hear this.
Okay. Hi. My
Yes,
name
we
is
can.
Danielle Kenworthy.
Thank you.
And this is DJ Kenworthy. Can you say hi, DJ?
Hi.
Hi. DJ is 26 years old. He just had a birthday. And we're going to talk about making dental care and visits successful. So DJ has Down syndrome and autism. He is G-tube fed, and he aspirates if he gets things into his mouth. So teeth brushing and dental care have always been kind of a challenge for us. So he has seen Dr. Rodney Pagao since he was 3 years old, and we moved to the Sacramento area. Before that, dental care and getting inside DJ's mouth was kind of a nightmare. And I didn't get a lot of support until we moved to the Sacramento area. So because of his needs, there's been a lot of trial and error and learning from others, learning from parents and professionals, keeping with routines. If we can do the same thing over and over again, and the more frequently, maybe shorter, but more frequently, then we see more success and rewarding things when we have positive growth, and maintaining regular appointments with cleaning under anesthesia. So DJ, his requirements are he has to have an anesthesiologist available there watching over him. So we go to the hospital and have his teeth cleaned, and have since he was 3 years old. It's been kind of a partnership between Medi-Cal and Alta Regional Center, the regional center where we live, and on who pays what. And I always make sure that dental care is a part of DJ's IPP. And that way we make sure that Alta knows that they may have to help out at times. We've looked for different ways. One of the things that we learned about through the State Council on Developmental Disabilities Regional Advisory Committee meetings was a triple-headed toothbrush. I'm not sure that you can see this, but it wraps around the teeth. And this worked really well for quite a while, much better than a regular toothbrush. And I'm sure it would still work for a lot of kids with special needs. Recently, we heard about this product on Facebook, and it's called the Collis Curve toothbrush. I don't know if you can see it. If I get it up to the camera, it just curves around the teeth really well, and we get it inside DJ's mouth. So we're going to demonstrate a little bit. We use mouthwash spray beyond the toothbrush, just real simple.
Oh,
are you going to help me? And DJ likes if I hold his chin real firm, and then we brush the quadrants of his teeth all the way around. We're going to do a quick demonstration here, not quite as long as I usually do. But for a long time, DJ wouldn't even let us inside of his mouth. So I used a little toothbrush that went on my finger and went inside his mouth. And I just kind of gently massaged As is the case with a lot of people with G-tube feeding, he gets a ton of plaque on his teeth. And Dr. Begau says this is the challenge that he has, keeping those. So because he isn't supposed to swallow, we just use a little bit of that spray to kind of freshen up a little bit. And he does not understand how to spit out anything. So we try, we keep working on it. So those are some of the items that we use to help us. We also do rewards. You like to look at your pictures that I have on my phone. So he gets a reward when he does well. And we have some toys that are specific to, he's watching a picture of him and his dad running. We have some toys in the bathroom. We just use specific to that. So another thing that I do to help myself is to set up dental cleanings with Dr. Begau's office. I know that when I call, I have a list of 10 items that I can go through and show you. Let's see. I'm going to share my video. Let's see. Share screen. And, oh, I can't do screen sharing right now. Let's see. We'll just have Sonia share these with you. I can contact
Donnell, you should be able to share it now.
I should be able to share now. Okay, well, I will do that now. Okay, let's see if it'll do that. Share. Okay. I just wanted to share with you 10 items that have to do with me that help me remember what I need to do. So first I contact my dentist, my son's dentist office, and set a time for a dental cleaning. And I know that the time that I set up and the actual appointment time may take several weeks to months. So I call very early. The dentist office sends me paperwork right away, and I always commit to returning it as promptly as possible. And I know that I may need to make copies of important things like my Medi-Cal or his Medi-Cal card, conservatorship paperwork, and send it along with that paperwork. Sometimes other doctors want to use that opportunity to get an MRI or other procedure done, and the hospital coordinates this, but I may need information to help me. I'm going to talk about that next. I like to keep an easy to read but thorough document on my computer that lists all the medical information about DJ that they would need to know. I make sure to update it regularly, and I often use it to answer questions from providers. I'm going to show you it. I sent it in a packet to Sonia, but it looks somewhat like this. We'll look at it at the end of this packet because I have it at the bottom. But I just have a picture of my son, some information, all of his allergies and who his doctors are and numbers, and I take that with me. I also use it when I have to answer questions from coordinators that call about the visits or the dental office. And I also keep a copy of his conservatorship papers with me. So I get ready early. That's a big clue. Being ready early helps me to settle and to know, and helps him as well, because DJ feeds off my energy. So if my energy is calm and I have things all planned out and it's packed and it's ready to go, then I don't worry. So I pack ahead. I always ask about what protocols need to happen. Like, is he not supposed to eat past midnight, have any feedings? He does eat, he just eats differently. He has a G-tube. And should I bring his G-tube extension? And is there any last minute paperwork I need to take with me? I make sure that's packed. And I also pay attention to, is my car all ready to go? That, that could be a problem if you get up in the morning and realize, whoops, I forgot to put gas in the car. So I pack myself snacks, and I usually make sure that his feeding is ready, but he can't have it until after procedure. Sometimes we wait till we get home because we know that a ride from the hospital is about 20 minutes for us. So he'll be home and in his own environment to eat. You look at pictures, he's turning away because he's bored with us talking. So I pack myself some snacks and a good book, and I plan for the time after we return home by not planning too much that day and making sure that I have an easy dinner planned. On the day of the dental cleaning, I go early so that we're both ready and we don't feel rushed. And I ask questions so that I can understand what's happening. And I make sure that I have the help, that I give the healthcare staff DJ's paperwork. During the procedure, I wait in the waiting room and make sure that I understand how I will be contacted when the procedure is done. Things have changed over the years. Sometimes there's a phone call, sometimes there's a big board with a number on it, but it's okay to ask and to ask how things happen. I always remind myself to relax, take a deep breath, and find gratitude for all the helpful people, and to find patience for things that don't always go exactly as they should, because you can guarantee that some things don't always happen. One time we were in the hospital ready for, trying to relax, and they came in really rushed and said, "Hey, can you guys go now? The patient who was supposed to go, it didn't work out. They didn't show up. Can you go early?" And so we had to change gears a little bit. And so it was important for me to remain calm and to help DJ remain calm. Hospitals always call the day after a procedure. So if I have any concerns or reflections on what went well or what went poorly, I save it for that phone call. Some things that I use to help dental cleaning appointments be successful. I use a social story. I'll give you a sample of that at the end. We use rewards like praise and time with a favorite toy, or pictures on the phone. I try to be prepared and cheerful throughout the procedure. I'm clear with healthcare providers about questions and what make a visit successful for my son. And I make and use a medical and history information sheet. So I'm going to give you some samples. This is a sample of a medical history and information sheet that I use, that I've developed through the years, just with all of the information that they usually ask listed. And whenever his paperwork, I'm showing you a 2-pager. His paperwork actually comes out to some 6 pages now, because I actually list all of the different surgeries and procedures, different things, just kind of a short history for him. And they always appreciate it. And they usually take oral histories, and many times you get interrupted. So this way, there it is. And then this is a sample social story. Hey, DJ, here's our social story. DJ gets to go see his dentist. He's going to have monitors. There's DJ with monitors on his body. And DJ will take his favorite toy with him. He may need to have a breathing mask, and he will go to sleep. Mom will be with him. DJ will wake up and go home, and his teeth will be clean. Yeah. So these are some of the things that we use to make dental care and going to the hospital for dental procedures better for both of us, successful for both of us. So appreciate your time. And you want to say goodbye to everybody? Bye. Goodbye.
Okay. Thank you, Donnell. I saw her log in a few minutes ago, but she's out of town. I wasn't sure if she'd be able to make it live. So we recorded that last week, and we appreciate her sharing some of her tips. So are there any other questions at this point? Feel free to raise your hand, or just, I believe there was a question. I see one from Judy. I didn't know dental services can be included in IPP. Do I have to ask service coordinator? Why didn't the service coordinator mention it? What happens if you had an IPP already? Kelsey, could you please answer that question?
Yeah, absolutely. Hi, Judy. Usually the service coordinator will ask if your loved one has been to a dental visit in the last year. At that time, they'll kind of ask how it goes and if there's any support that you need. If you've already had an IPP and it wasn't already written into your individual program plan for your loved one, you can call your SC and request a planning team meeting, and they can do an addendum to the IPP and make sure it's incorporated on next year's IPP. I hope that helps.
But just to reiterate, the regional center doesn't replace services that Denti-Cal or Medi-Cal would be paying for.
Absolutely. Yes. Thanks so much, Sonia.
Sonia, I wanted to answer one thing Veronica had asked earlier.
Oh.
While Natalie and I were talking about why dentists are so quick to extract patients with Denti-Cal, extract their teeth, instead of making a priority to preserve the teeth. Something that I want everyone to know is whether you're in Sacramento County or any other county, you have the right to a second opinion. And so you can, you're in Sacramento County, you can call your dental plan and we can help you get to another dental office or dental home to have a second opinion. If you're in another county, you can call another office and let them know that you'd like a second opinion visit. And a second opinion visit tends to be a little bit faster. They would use x-rays from another office that were already taken, so you don't have to do those again. And they would kind of take that information from previously. And so you have the right to get a second opinion. You don't have to just go with that initial, treatment plan of having a tooth extracted. So I just want to make sure you know that you and your loved ones have rights.
Thank you. And I see another question from Gail about putting it in the IBP. You just, first of all, you can call an IBP meeting anytime you want, anytime a new issue arises. There's a new concern or something new you'd like to discuss with your service coordinator. You can call your service coordinator anytime. You don't need to wait for your IBP meeting. So always remember that. And again, as Kelsey mentioned, it's not about putting dental services in that would replace what Medi-Cal or Denti-Cal are supposed to fund or your private insurance. This could be something that's a supplement or complement to services that you're getting, or something that would be not funded by one of the other agencies. The regional center is always the payer of last resort. I would like to launch a poll and then we'll get back to the next question. So this poll is about this training, this workshop tonight, and I'm going to launch it now. It's real quick, 2 quick questions. The first is, did you learn something about accessing oral health care? Yes or no? It's a 2-part question. The second part is, are you satisfied with this activity? And the options are yes or no. Our first poll was so complicated, we decided to keep this one simple.
I see another question has come in. As mentioned, California North State University is increasing training education to the dental industry regarding patients with special needs. Are they also doing this with the medical industry? Right now, because the program with California North State University is a dental program, we're currently targeting the dental population. We have done and have heard feedback from stakeholders that receiving dental care is one of the hardest things for a person with disabilities, or even without. So we've also heard from parents that they can get all of their healthcare coordinated, but sometimes they have a really hard time with dental. So we're trying to address this special need for increasing education and information to dental providers regarding developmental disabilities. And one of the things we've also noticed is that as soon as a dental provider notices that a client has a disability, they will not serve them, or will state that they can't see them due to their disability, when perhaps maybe they could with a little training and guidance. So we want to be sure that we're increasing and we're allowing the dental plans to do what they're here to do, and make sure that dental care is being given.
Thank you, Kelsey. So we are at 8 o'clock and I just want to wrap up. I don't see any more questions. So we just want you to know that we know there are challenges, and we know there are challenges accessing dental care. We know there are challenges figuring out what plan you have, who to call, where to go, understanding the information you're given. Sometimes you're given misinformation. Things change. The laws have changed. The coverage has changed. Even with the same plan, something may have changed, as Kelsey mentioned, the history of some changes to adult dental care especially. So information you may have had 6 years ago may be different now. So it's worth going back and asking again. You have Danielle's email address. You can always contact her and she will figure out what plan you're on, regardless of what county you're in California, or point you to the right direction, get you to your regional center or to a local plan where you can get information. We'll also share the phone numbers at Department of Healthcare Services, where you can also call, and they want to hear from you. They often tell us on the committee, we're not getting that many calls of people complaining, so we think everything's fine. So they really, really want to hear from you. Advocacy really, really counts. If they got 1,000 calls tomorrow of people saying there aren't enough dentists, or the dentists are saying they can't provide services because they don't get enough money for reimbursement, or whatever the concern is, that would make a huge impact, right? So they really listen to advocacy. So your voice matters. When we put out an email and say, we want to hear stories, please respond. If I contact you or another agency is looking for advocacy, your voice really, really counts. And it's the voice of so many of you who helped to get adult dental benefits restored a couple of years ago. So we know there were several years where adults who had Denti-Cal were not eligible to get any dental services. So there are several years where people did not get their preventive care. So we know there's a kind of a backlog of people getting appropriate care, and those individuals learning that now they can get care. So you have your service coordinator to reach out to, you have Danielle, you have your dental society. You can always email or call me and I'll point you in the right direction. There are efforts through the regional center, especially Alta Regional Center, to help provide supports to increase somebody's ability to get care in the dental chair so that they don't have to go through dental or hospital anesthesia, which can be very involved. So we wanted to start this conversation, and we appreciate you joining us, and we will most likely have another presentation like this in a couple months. Share the word with other families. Feel free to reach out to any of us and look for an email tomorrow with some links to the information that was shared today. So again, thank you, and especially thank you to Denora, there you are, Denora, for interpreting tonight on short notice. We really appreciate that. Yay. And we have one, okay. So please feel free to put in the chat. We'll keep the line open for just a minute. Any comments you have about tonight, what we could do different, what we could do better. I'm going to post my email address once more. Feel free to reach out to me. We always want to hear what was helpful, what wasn't, what you're still needing to know, what questions you still have. And with that, we thank all of you for joining us. Thank you, Robin, for helping to monitor the chat. Thank you, Kelsey and Mary and Danielle. And we will thank Danielle for Donnell for her video recording, and DJ for joining us, and Natalie as well.
And thank you, Sonia, for coordinating all of this. We appreciate
it.
Thank you so much.
Dinora, ¿me pueden mandar la invitación para la próxima? Sí, le mandé el correo electrónico en el chat porque a mí me invitó una amiga.
Nice. She said thank you, Denora, for being in the chat and helping.
Thank you so much.
Muchísimas gracias, excelente traducción y excelente información. Me voy a comunicar mañana con mi coordinadora de servicio del centro regional. Yo pertenezco al área de Harbor Regional Center. Y para la próxima junta, entonces traigo la respuesta.
A little too fast for me.
Dinora, can you hear me? Are you able to translate the question? Oh, I can't hear you. Can we get you out of the...
Gracias, gracias Dinora, gracias a todo el equipo. Excelente información. Gracias, suerte.
De
Gracias.
nada.
Thank you so much, everyone. Have a great evening.